I'm Tony Sherba. I'm the co-founder and CEO of Getty, a software development and design studio in San Francisco. This past weekend, we did a hackathon, all virtual, called Hack the Virus. The idea for it came from really just a desire to solve problems. There were a ton of people who were, kind of sitting at home on the weekends, wondering what they could do with their time. A lot of times hackathons get a bad rap because it's a bunch of people just building things without any real guidance. So what we wanted to do to make this hackathon more meaningful was really bring in voices from the experts. And we thought, especially at this time, it would be really important to hear from the people on the front lines, what's going on so that we could build meaningful solutions specifically for them. First, we started with the medical response from them, really got to hear, what is going on in the hospitals, what are they seeing, and how can, simple pieces of software help.
I have a lot of friends and people that I know in Philadelphia constantly ask me, like, where can I get a test? And honestly, like, I don't really know all the time. I have the list from the city of where you can go and I send people to that. But I think there's like potential for app development or software development around like me as an individual, plug in what kind of insurance I have, and like it could show me where I could go to get a test. It's hard to kind of dig through. There's, at least in Philadelphia, and I imagine lots of other places, there's universities that have set up testing sites. The city has set up testing sites, and trying to figure out like which one of those you can go to without insurance and without a doctor's prescription is challenging.
Gotcha.
So it'd be cool to figure out how to put all that information in one place for people. I think one of you guys could make an app for people to figure out where they can get a test. That would be awesome.
I think for folks like me that are really data driven, there's a lot of data out there. And I think, one of the challenges for someone like me is, I might have to go and try and hunt it down. And I think that's definitely a challenge in some of the times like these where most of my efforts need to be kind of focused on, the operational side. So, I know that, departments of public health and the CDC is publishing a lot of data on trended positive results and total number of tests done. But if you work at a smaller facility like in some of the areas across Mass, you might think, okay, well, I could really use some specific Massachusetts data, which is pretty much on the Department of Public Health website. That's a lot of data that's going to be available, and it's really hard to kind of match up what's important. So I think, someone to help start to get all that into one place is definitely a need, even on the, the front line, so that I can go somewhere and say, here's the way Massachusetts is trending, and I can export it to Excel and compare it to my own facility and, see, okay, here's what's happening. And if I can look at another state that might be in a similar demographic as mine, I could say here might be some things we can expect,
From there, we thought it would be also really important to hear from other industries that were getting affected by the coronavirus. Specifically small businesses. We talked to Denise Tran, the owner of Bun Me, who has 4 different restaurants in San Francisco, that it was able to give us some insight into what's going on in the restaurant world right now, because they're being affected pretty significantly. We wanted to talk to some people from education. So we talked to Liz and Chatal from the Early Learning Lab that gave us some insights as to what they're doing as far as, having parents teach kids remotely from home. And then we also just wanted to talk to some people about general health and wellness, people being at home and not in their normal routines, and being stressed out is pretty, is something that's affecting all of us. So we talked to Dr. Lisa Oldson, who specializes in obesity and internal medicine. And then we talked to Dr. Debbie Rosman, who is the president and CEO of HeartMath, about really just kind of the stress that people are under right now and how to potentially alleviate that. So the hackathon was all online. We had about 120 people sign up for it. We had people submit ideas based on the interviews that I did with the experts. We got about 10 different idea submissions for projects from that. We ended up with 5 really great submissions. And all the teams worked incredibly hard, and getting things built over the course of just over 24 hours. But the winning submission was inspired by an idea from Dr. Daphne Owen.
The service we created is ReachCare. ReachCare is a texting platform that helps people find testing centers within their zip code or near their zip code. We thought that this would be an incredibly easy and effective service for people that may not have a lot of accessibility to the internet or who may not be tech savvy. And here's an example of our final product.
I'm very impressed with this platform. It's bare bones. I can tell you I do telemedicine visits with my patients. A lot of them don't have smartphones or laptops or iPads. They have these old Motorola flip phones, but they can get text messages. I think it's a great way to reach people. You have to find a way to reach people who are otherwise unreachable. And I think it's fabulous. You guys have put a lot of thought into this. And I know for a fact that a number of my patients in this area, and Dr. Daphne's too, I'm sure, would actually take advantage of this technology, because it's simple, it's easy to use, and it will reach a lot of people.
I don't know why we don't have this now.
I was just thinking the same thing.
So the second place submission was from a team that was doing mapping. I spoke with Ben Colonna, who does operations at the VA, and he had mentioned that there was a lot of confusion around hospital inventory, and so a team basically got some public data sets and mapped them in different counties all around the country, showing what the hospital inventories are like currently, which is going to help a lot of people like Ben who are working operations for hospitals.
We are Team Broken Crown, and we developed a geospatial application to help in the medical community and help with basically what we were thinking, resource management. So the idea was to develop a mapping application that pulled together several different data sets that we were able to pull from the web. These purple dots that you see represent hospitals and their bed capacity. What we can do with that is, ideally, we would have wanted to have basically a sketch tool that you could take and draw an area around this and export it out to CSV so you could see how many resources were in a given neighborhood. Ideally, we would want to include things like drive times and routing and all of that. What you're seeing here also is these blue dots are, it's the dot density of how many tests were done per county. We got these data from New York State, and we were able to find a data set that we could join to a county layer and get our tested quantities and how many positive results we had for that. So I think in aiding the medical community, if we were able to export this out to a CSV, you could do a lot of data analytics with it.
From a medical perspective, this is very important in terms of analysis of granular data, especially looking at things like longitudinal tracking of virus patterns. Where are we seeing outbreaks at any given time? Where are we lacking testings? For instance, looking at this, only a handful of tests were done out there, and there's a center with X number of ICU beds. So if we're looking at the component of the ICU and if they're all full, then we can expect a larger outbreak in that particular community. Maybe we can use that to divert resources like ventilators or masks or other personal protective equipment to that particular community. It's definitely important to look at this. You can map this on socioeconomics. You can map this on health insurance, regionality, access. There are large numbers of data that you can get from this sort of granular, look. So, thank you guys for putting this together. And I think on a regional and national scale, something that's highly usable, depending on what layer you put on it.
So during this hackathon, we, were able to get some really awesome ideas started. We're working with the teams to see how we can launch them and get them out. I really just want to thank, all the experts that we had that helped inform these hacks and work with the team on them. And then all the participants. I mean, we had a bunch of people that spent a weekend, building something and working on something. I think it was a really just meaningful thing for all of us, in the development community, to kind of come together and, really start doing and building and making a difference. And, that's really how we're going to find our way out of this.